Joining us today is Moody Chisholm, the president and CEO of UT Health East Texas, to tell us a little bit about how the hospital has resumed elective surgeries. Thank you so much for joining us.
Thank you, Cynthia. Nice to be here.
It's our pleasure. So we know that UT Health East Texas opened back up for elective surgeries this week. Can you tell us about how that's been going?
Sure. On Wednesday, we started back with elective surgeries. As you know, we've been doing emergent surgeries throughout the COVID pandemic. But we resumed elective surgeries this week, and we're thankful to have the opportunity to do that because we have been concerned that many elective surgeries are urgent and they're very important, and we've been concerned that if people put off these procedures that are necessary, then these conditions that they're dealing with could become more emergent and more difficult, and it could exacerbate their situation in many cases. So we're thankful to have the opportunity to move forward with cardiac cases and cancer diagnosis cases and many other more urgent cases because of pain or other issues.
Exactly. I'm glad you brought that up, that even though a surgery can be elective, it can still be urgent. So tell us how this news has been received by your patients.
Very positively. For all of your viewers that have had procedures, medical procedures or surgeries before, they can probably relate to the fact that once you and your physician decide that you need a surgical procedure or a procedure of some type, you want to get that over with. You don't want to be worrying about it, and so our patients that we've contacted and scheduled to come back in and that have had procedures already have been really excited to have the opportunity to move forward, get their diagnosis complete, or get pain resolved, or whatever the situation may be that they're facing.
Right now, after a couple weeks off, or however many weeks it was, kind of tell us how the hospital's been ramping back up to perform these surgeries that have been delayed.
Yes, ma'am. So one of the most important things to emphasize is that we've been isolating all of the COVID-19 patients from the very beginning. Even at our ER, we have a separate area where we isolate all patients with respiratory issues to separate them from patients with possibly a broken arm or chest pain or something that is not COVID related. We screen every patient when they come into the hospital, and of course all of our visitors, we've limited visitors now as well. All of our caregivers are screened every day, and so all of these factors go into ramping back up, and we've been taking a tiered approach to getting back into surgery again. So we continue to do the most emergent cases as our first priority. But now we are phasing in cases that use the least amount of PPE or personal protective equipment, and that use the least amount of inpatient hospital beds, because as you may know, the governor's order requires that we retain an available 25% portion of our beds for COVID care, and that we retain as much or preserve as much of our PPE as possible. So the next level would be those that don't use much of that, but are important for patients from a pain perspective or diagnosis perspective. And then the third tier will be those that do require hospitalization and some PPE, but they're not long lengths of stay in the hospital, so they won't eat up a lot of capacity in the hospital. So we're phasing those patients in.
It's very comforting, I'm sure, to a lot of people to hear these extra precautions y'all are taking. So do you think patients should still feel safe as they enter a hospital, whether it's for a checkup or for surgery?
Absolutely. As I mentioned, every one of our caregivers is screened every day. They have to attest each day to having gone through the screening process before they start their shift. And as I mentioned, we separate all of our COVID-19 patients out. We mask every patient, every visitor. Now, by the way, for our surgical patients and procedural patients, they are allowed to bring one additional person with them, but only one person with them, to accompany them up until they enter surgery. But both the patient and their visitor will be required to be screened before they're allowed to come in the hospital. And if they don't pass the screening test, by the way, we'll have to reschedule or postpone their surgery until they can pass the screening test. And that visitor then would, though, if they pass the screening test, would be able to accompany them to surgery. And but then they have to leave after the patient goes back to surgery, or they have to go to a designated waiting area where we have provided the appropriate physical separation between each visitor that's waiting for their loved one in surgery. So all of these approaches help to keep patients safer. And again, masking everyone in the hospital, our patients, our visitors, our caregivers, it helps to keep patients safe.
Moody, we know you're so busy, so thank you. We really appreciate you taking the time to chat with us here on East Texas Live.